Advocating for a child in a clinic or even a hospital setting can be scary at times. I'm Lydia, I'm Mom's Healthcare Navigator. Send this to another mom so they can confidently navigate healthcare as well. So here are 5 ways to do it safely. Now, number 1, you don't have to sign all the papers all at once. Take some time, read it over, or sometimes you can just simply say, can I please take these home and read it over and I'll decide on that treatment. The second is prepare for your visit. Make sure that you have clear records of signs or symptoms that you're seeing in your child that you want to discuss, because then it's an open discussion and you have something written down to refer to. It's kind of hard to remember when you did this last or when that happened, especially if you're being asked a bunch of questions all at once. So try and have accurate records. And then the third is asking, is this medically necessary? What is the risk versus the benefit of this treatment plan? It's really important to ask that question so that you know in your particular situation if it's something that you feel is going to help or potentially cause more harm. You want to have that entire picture. The fourth is bring support. Extra pair of eyes and ears is always important. Someone can track and record things down on a sheet of paper while the physician is discussing things so you remember the instructions, and it also just helps you make sure that you have the courage and you have the ability to speak up. And if you have other small children, that other person can help with that so you're not as distracted and you're focused on what you're being told, and then you can actually engage in a better way. And then the last thing is I would always ask for differential diagnosis. So in other words, if the physician says, I think it might be the flu, you might be able to just ask and say and advocate and say, well, what else could it be if it's not the flu? So that you have an idea of what to watch for if in fact the physician feels it's the flu. At least you have what else it could be and what you should be watching for. So if things get worse when you come home, you know exactly what to do in that situation. So really prepare yourself with that treatment plan. And the best way to do this is to advocate. And advocate is simply speaking up, not being aggressive, but being assertive, asking your questions. Being an active participant in your care is going to reduce any risk of harm by up to 50%. So it's really important to ask the questions and be involved and engaged. Follow for more safety tips. Until next time, take care.